So I'm going to ask you a question that is, I don't want to say it's controversial, but we're talking a lot about, obviously, physician preference items, and the first part of that word is physician. So how important is physician engagement in this process?
It's critical because the physicians are driving the change. We've worked with hospitals throughout the country, and we've dealt with physicians throughout the country, and those that have buy-in on the process and are comfortable with the numbers and approve and work with us and work with supply chain and senior leadership at the hospitals, we're successful 100% of the time.
Yeah, I agree with you. I mean, it's unbelievable. But I mean, the process takes a lot longer. You need to do it right. You need to gain trust, like you talked about earlier with numbers. But if you do it right, engage them and have a real strong process, we've been successful 100% of the time. I agree with you.
Yeah,
it's just
absolutely.
when you take shortcuts or don't do things right or out of order, you don't involve them, you don't give them information, I think that's where the missteps occur.
Right, absolutely. We're working with a children's hospital recently, and we're reporting directly into the chief financial officer, and it was the spine initiative, which was the biggest opportunity for them to reduce costs. So, we talked to the CFO. The CFO had a conversation with both of the physicians. Then I followed up the conversation with both physicians, sent them the information, answered any of their questions. They had multiple calls with both of the primary physicians.
Because they had questions and they wanted to be informed.
They wanted to understand, who we were, first of
Right.
all, and understand the data and understand where the benchmarks came from. And then also be comfortable with those benchmarks, because again, they understood and they knew, and both of them said to me, "Oh, well, I know that there's better pricing in the marketplace." And they said, "Well, that's we're not going for the best pricing. We're going for the best pricing for the children's hospital based on your volumes, market share, et cetera." And they were very comfortable with the approach. So when we engaged both vendors, separate vendors, they immediately said no. I called both of the physicians back up, and within a week we had contracts for the pricing we outlined with both vendors.
Yeah, I mean, it's a great story. And I had one of my own. About 8 years ago, we were working with, it was a very prominent spine physician. He had extraordinary amounts of volume. He's a great guy, talented physician. And so when we saw the spine data and we benchmarked the pricing, again, we didn't go for crazy number that does exist. We went for the appropriate pricing based on utilization and market share, and we went to the vendor, and I was no, and again, I don't know where you're getting the data and all the conversations we hear. So we went back and we dove a little deeper. We got reimbursement data. We sat with the CFO and the physician and laid out the Medicare reimbursement, their major managed care reimbursement, and showed all the data without going on to specifics. The physician got up, excused himself, made a phone call, came back in and said he's on board and we're going to get the pricing. So we left the room and I got a phone call saying the pricing would be in place immediately. Yeah. I mean, it's just
good example.
Yeah. So I think it's absolutely imperative, and I do think that there has to be a well thought out process, and it's got to be a trusted process, and it may take a little more time, but I think organizations will get the results.
Absolutely.